Hello, and congratulations on taking the next step towards your new smile. I hope you're feeling comfortable after your all-on-X procedure. I'd like to guide you through what to expect over the next few days and share some important instructions to help ensure a smooth recovery and the best possible outcome for your treatment. For the first 3 days after surgery, it's very important to avoid creating any pressure inside your mouth. This means no smoking, no vaping, no spitting, no drinking through a straw, no forceful rinsing or swishing, and no heavy lifting or strenuous exercise. These activities can disturb the healing tissues and increase the risk of bleeding or complications. Some swelling, bruising, and minor bleeding are completely normal after surgery. Although your mouth is a relatively small area, all-on-X surgery is still a significant surgical procedure. Swelling is usually at its worst between 48 and 72 hours after surgery before it gradually starts to improve. For the first 3 days, apply an ice pack to the outside of your face for 15 minutes on and 15 minutes off throughout the day. Keeping the inside of your mouth cool with ice cream, icy poles, cold smoothies, or chilled drinks can also help minimize swelling and improve comfort. After the first 3 days, switch from cold packs to warm compresses, again using them for 15 minutes on and 15 minutes off. Heat helps improve circulation and encourages bruising and swelling to resolve more quickly. Bruising commonly lasts between 5 and 10 days, although in some patients it may persist a little longer. Minor oozing of blood or blood-stained saliva is normal for up to 72 hours after surgery. If you experience heavier bleeding, gently bite on a clean gauze or a damp tea bag over the area for approximately 15 to 20 minutes. If the bleeding is excessive or doesn't settle, please contact our practice immediately. It is not uncommon to experience a mild temperature or slight fever during the first 24 to 48 hours following surgery. However, if your temperature remains elevated, continues to rise, or you're feeling generally unwell, please contact us straight away. Some patients experience nausea after surgery. This is most commonly caused by taking pain medication or antibiotics on an empty stomach. Before taking your medications, try to eat something light such as yogurt, a protein shake, or another soft food. Depending on the complexity of your procedure, particularly if surgery was performed in the lower jaw, you may notice numbness of your lips, chin, or tongue after the local anesthetic wears off. This usually improves gradually with time. For some patients, recovery occurs over a few weeks, while for others it may take several months. We'll continue monitoring this at your review appointments. Occasionally, tiny pieces of bone may naturally work their way through the gum during healing. This can occur for up to 6 weeks after surgery and is usually part of the normal healing process. If anything concerns you, simply let us know and we'll assess the area. One of the most important factors affecting implant success is smoking. Smoking significantly reduces blood supply to the healing tissues, slows healing, and increases the risk of implant failure. Ideally, you should avoid smoking completely. At an absolute minimum, we recommend avoiding smoking for the first 6 months following implant placement to maximize the long-term success of your treatment. For the first 5 days, avoid hot foods or hot drinks, spicy foods, foods containing small seeds, and carbonated or fizzy drinks. Hot and spicy foods can irritate the surgical sites, while seeds may become trapped around the healing tissues. Carbonated drinks can interfere with healing and should be avoided during the early recovery period. Stick to a soft, nutritious diet. Food options include smoothies, protein shakes, yogurt, mashed potatoes, scrambled eggs, soup, once cooled, oatmeal ice cream, soft pasta. A simple rule to remember is this: if you can't easily squash the food between your fingers, it's probably too hard to eat. Even though your new teeth feel strong, your implants are still healing underneath. For the first 3 to 6 months, avoid biting into hard foods while your implants integrate with your bone. Keeping your mouth clean is essential for successful healing. Continue brushing any natural teeth that were not involved in the surgery as normal. 3 days after surgery, you can begin gently cleaning around your new teeth using your toothbrush. Use only a soft toothbrush and be extremely gentle. Please do not use toothpaste when cleaning your temporary bridge, as many toothpastes are abrasive and can dull or scratch the polished surface. You can also begin using your water pick 10 days after surgery. Use the settings recommended by our team and direct the water gently around your prosthesis. Don't worry if you're unsure, we'll demonstrate exactly how to use it at your first review appointment. Please take all of your medications exactly as prescribed. If you've been prescribed antibiotics, it's very important that you complete the entire course, even if you're feeling well. If we prescribe an additional course after surgery, simply finish your current antibiotics first before starting the new prescription. For pain relief, we generally recommend alternating or combining paracetamol and ibuprofen, provided they are safe for you to take. Please follow the dosage instructions provided on your printed post-operative information or as advised by your dentist. Remember, you've just had major surgery, so give yourself permission to slow down. Rest, stay well hydrated, eat nourishing soft foods, and carefully follow these instructions. Every day will become a little easier. The temporary teeth you've received today are an important part of your healing journey. They allow you to smile with confidence while your implants integrate with your bone. Before long, we'll be creating your final smile, one that's stronger, more comfortable, and designed specifically for you. If at any stage you have questions or concerns, please don't hesitate to contact our team. We are here to support you every step of the way. Thank you again for trusting us with your smile. We look forward to seeing you at your post-operative review appointment.